Hey everyone, welcome to the Cash Practice Solution Podcast. I'm your host, Dr. J, and today we're getting into something big. I'm talking about $2 million big. Now, I know what you're thinking. $2 million in this economy? Stick with me. This isn't a pie in the sky theory where I'm going to tell you to buy a bridge in New York or I've got property in Arizona on the beach. Nope. This is about practicing high quality medicine and getting paid what you're worth. You went to school for your entire youth. Imagine that, getting paid what you're worth. So what's the deal with a $2 million practice? It's not just about the money, honestly. But it doesn't hurt, the money. It's about relationships. It's not about that superficial, hey, it's great to see you, cocktail party level relationship. The real deal is building trust with your patients by learning about their hopes and fears, their real story. We've talked about this in the past. We use technology to do the superficial data collection, which is kind of the norm in medicine where we do the screening, bowel function, family history, meds, all that. We use technology to collect that and then provide that to us. So we have time to go deep when we could do the face-to-face interview. And then you have trust. And trust is like a Wi-Fi signal. When you're in that range, everything works. Everything's smooth, no frustration. That's what trust does. And that's what the $2 million practice does for you. It enables you to build a trusted relationship, and the trust enables you to have a $2 million practice. All right, let's break it down. It's a $2 million practice. It's kind of like the unicorn of the medical world. When I worked in the emergency room 20, 30 years ago, I heard about a doctor in our area that had a cash practice, and I thought, how could that possibly be? And it was just cash. It wasn't even necessarily a $2 million practice, but it was hard for me to imagine. And now I live it, and we have lots of doctors who are living it. Here's the thing. That idea, it's a reality now. It's not conceptual, it's real. And it results from a well thought out strategy and planning. It starts with one simple idea. Ditch the middleman. No third party. No insurance company hanging around like the third wheel at the dinner date. Nope. Think about it. Insurance has completely poisoned the doctor-patient relationship and your relationship with your own profession. The doctor-profession relationship. It's hard to do your work because you're just fighting against a system that's actually designed to keep you from spending money. That's what it's for. Or providing care. It's like trying to have a heartfelt conversation while you're being contradicted on everything that you're trying to say. I think you know people like that. I don't know, you probably do it. When I'm making a phone call, I like to leave the room because I don't want anybody else involved in my intimate conversations. That's what insurance is like. It's like somebody listening to you the whole time and having something to say about your phone call. No, doesn't work. When you eliminate the middleman, the magic happens. Your practice becomes happier, healthier, and you find yourself in a better financial position than you ever thought possible. The best part, you get to focus on what matters, your patients. Remember them? They're those people who come to see you for insight and care and not to sit in a room while you battle it out with their insurance company over the medical necessity of something that you're doing. When I check the office mail at our office, I look for insurance claims kind of just to entertain myself because we don't handle insurance. We get claims and stuff from them because they're confused generally. And then we predict the number of no's that we're going to read on the page. And pretty much that's all I read is no, 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 no. So I can't imagine what it would be like to go back to insurance-based care. So let's talk about what that means then in terms of what you would do. Direct patient care? Concierge? Fee-for-service? I mean, fee-for-service has been around forever. And working with an insurance company under fee-for-service, that makes no sense. Everybody knows about that. You can do fee-for-service cash. Fee-for-service cash basically means that patient pays for what they get a la carte, just like that. Very, very established practices do that easily. It's not a problem. DPC is direct patient care. What that means is you and the patient are the only ones involved in a relationship. The patient uses their resources, money, chickens, whatever, to pay you. There's no third party. Concierge care, it's like fee-for-service, but the problem is for some of them, they do what's called a hybrid model, which means that they have a little insurance on what the insurance covers, and they charge a membership fee. I think that creates a lot of that nonsense about dealing with the 30 to 40% of overhead and all the other problems. But you got to decide what do you like? What works for you? When you look at practice, do you want it to be a shiny, beautiful, physically attractive, or do you just want the bare bones? What's going to get you there? DPC practices, they work really well as a basic model to get the job done. There's a lot of doctors who are doing an amazing job in like really, really poor environments. People who don't have hardly any money at all providing DPC care, and they're doing a really good job. It's kind of like Netflix. You can get as much as you want. You can watch all day if you want. It's not expensive, somewhere between $50 and $100, and get all the basic care you need. That's great. If you like that, that's a great option. There's tons of resources for DPC. There's no surprise charges, no ads, easy access. Concierge is kind of the VIP version of that. If it's not with the hybrid, I'm going to put the hybrid aside. That's a much higher cost. Generally, you're getting more personal attention, where there's a little bit more house call, a little bit more hand-holding. And for some doctors, that's really what they like. They're going to have a smaller panel, 200 or 300 patients, not 600 or 700. I really just don't like the hybrid thing. I really like fee-for-service. You can look at fee-for-service as a membership that doesn't cost anything. It's a $0 membership. If you really are bonded to your patients like I am with my patients, if they need me, they can get me. I don't have to have a membership fee. And if they need me to do something, they'll pay me. And they know that. So phone calls, emails, forms, whatever it is, they pay me for it. It's not a included service. It doesn't. So I don't include hybrid or insurance-based practices in any of our strategies for $2 million practice. You know why? Because they generate 30 to 40% overhead. Then you have really unhappy clients, and you have really unhappy staff. Morale's horrible because you open an envelope and it basically says no. Nobody likes no. And that's a no situation. With cash only fee for service, no membership fee, pay for what you need, and it's good. I really like it. I think for me it really works. It's simple, and in our case, it's just what the doctor ordered each time, literally. So I really like it. But whichever model you choose, DPC, concierge, which is kind of VIP, or fee for service, as long as it's just you and the patient, you're a winner. You're going to win. You're in control. Your patient gets the kind of care they want. Makes them feel like they're important, which they are. You already know that, but sometimes they just miss it because you're busy with all this other stuff that's just distracting you. So staying in a third-party model is a mistake. It's like wearing shoes that are too tight. They wear you out. They'll drive you crazy. You're going to want to scream. And in fact, most doctors are screaming. They just feel like they're stuck. But I'm going to tell you you're not. I think most primary care doctors are at that breaking point. There's a recent study by Doximity that says 52% of doctors right now are saying that DPC model, the direct patient care, is a good idea. That's more than half the doctors who do primary care. That's pretty good evidence. Lots are willing just to quit because they hate it so much, because they feel trapped. And they don't feel rewarded, and they're not getting the fulfillment because they're not doing what they think is best. So DPC, concierge, fee-for-service, no insurance. Before you throw in the towel, or the stethoscope in your case, this is a way out. It's a way up. You can still practice really effective medicine, care deeply for your patients, and I'm going to tell you, you have the bandwidth to care much more deeply because you're not burned out, and live really well. You can make a really good living. It's like getting your cake and eating it too. You can do it. In upcoming episodes, we're going to go into like the recurring revenue and recurring patient referrals, how that works, how you can actually create that, on a very, very inexpensive level where it doesn't cost you much to get a great return. We'll give you practical tips and strategies and, of course, some stories, because I like doing that, to help you build the practice you've always dreamed of. So stick around. This is where things get exciting and really where the rubber meets the word. Well, that's it for today. So if you've ever felt like you're stuck in a practice model that's holding you back, remember, there's a better way. Join us next time as we reveal the power that drives patient results and financial success, outcomes, income, and how to improve both without compromising patient care. Sound good? Well, if you want to maximize your cash practice or start out on the right foot, I'm going to invite you to check out the Cash Practice Scorecard, which we make available at cashpracticesolution.com. So there's a great article by Lee Gross called Understanding the Hybrid Direct Primary Practice. You can look at that. It's great. It'll give you some great insight into how you can make a better decision about that. So thanks for tuning into the Cash Practice Solution Podcast. I'm Dr. J, and I'm reminding you, great medicine doesn't have to come with financial misery. So until next time, listen to your patients, learn their stories, and love them wholeheartedly, and you will be unstoppable.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you, and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.